In this video, we're going to be performing a 12-lead EKG. Our patient should already be attached to the monitor using the 4-lead cables. Make sure the device is powered on and you're able to see the 3 different lines on the screen. You'll find your 12-lead EKG cables over in the left-hand side of the monitor. Go ahead and pull those out. Get the wires untangled. Sometimes when they come out of the bag, they're a little coiled up. That's okay. Alright. We look at the end of these, you'll see you have V1, V2, V3, V4, V5, and V6. Okay, so we're going to need 6 stickers out of the drawer here. The cardiac monitor takes 12 views of the heart using only 10 wires. It does that through augmented voltage. We want to make sure that we go ahead and attach the electrodes to the wires before placing them on the patient. The amount of force it takes to push this button down on the sticker while it's attached to the patient is enough to cause them pain, especially in your elderly patients or someone who may have fibromyalgia or some nerve disorders that cause them excess sensitivity. Alright, so we come over to our patient, we explain to him, sir, we're going to do an EKG. We're going to need to raise your shirt up here. Now's a good time to make sure the patient's got a sheet or a blanket. This is my son, so I'm aware of, he's pretty comfortable with me, so we're going to raise his shirt up. Any other time, we'd offer the patient a blanket to make sure that we preserve their privacy. Remember, they've called us during a time of emergency, so we want to make sure we provide them the best care possible. V1 goes at the sternal border on the chest, in the 4th intercostal rib space here. So you want to feel, you can, it doesn't have to be exact, but you just want to be close to that sternal border. So V1 attaches here. Okay. Next, you got V2. Occasionally you'll have a time where the patient's extra sweaty or oily, or maybe they've applied some lotion to their chest and that won't stick well. In those times you'd want to use just a regular rubbing alcohol prep to just cleanse the skin before applying the stickers. V3, maintaining in line with the sternal border down about the xiphoid process here. This will be your 5th intercostal rib space. Connect V3. I like to go ahead and place V6. V6 goes mid-axillary. Okay, so we get up here in the armpit. Don't be afraid to get on up there, maintaining in that 5th intercostal rib space mid-axillary. Next, V4. V4 attaches at the nipple line mid-clavicular, so you can see your patient's collarbone. You follow it down the mid-clavicular, maintaining that 5th intercostal rib space. And then V5 splits the difference between 4 and 6. So once we have those connected, you're going to get the other end of your cable here, and you find the EKG block. You want to see how these line up. This just plugs in, make sure it's firmly connected. Once connected, we can cover our patient back up. Again, we want to maintain their privacy here. This is somebody's mother or father, grandmother, so we'll make sure that we do the best job we can. On the front of the monitor here, you see the heart beating on the screen. The amplitude's a little small here. You'll have that sometimes, especially in children. We'll hit our 12-lead button. It'll ask for the patient's age. So we turn our dial wheel here. I know that my son is 11, so we'll turn our dial wheel to 11. Once we get the appropriate age on the screen, we press in. It'll ask for the patient's sex. He's a male. And we press in on the dial again. It will now acquire the 12-lead. This is the time when the patient needs to remain still to make sure we get a good data here. Once the 12-lead is complete, it will automatically start printing. We can tell our patient they can move and breathe normally. Alright, and now we have obtained a 12-lead EKG. This is good to bring along with the patient to the hospital for the physician to interpret, or if there's a paramedic on board, they can interpret the 12-lead. We're looking for signs of ischemia here, looking for ST segment elevation. That's something that we talk about later on.